Yesterday there were 580 locally acquired cases of COVID reported in New South Wales in the 24 hours to 8 o'clock last night. In the same period, there were 79,894 COVID-related tests. It's coded tests. Sorry, there were 79,894 tests for COVID in the same period. In terms of vaccination across New South Wales, we've now had 89.8% of the 16 and over population who've received a first dose of COVID vaccine and 71.5% who are fully vaccinated. The total number of vaccines administered in New South Wales is now approaching 11 million. So thanks everyone for coming forward to get vaccinated to protect yourself and your communities from transmission. In terms of hospitalisations, there are currently 812 people with COVID in hospital, with 163 in intensive care, 75 of whom require ventilation. In terms of vaccination of people of the 163 people in intensive care, 117 had not been vaccinated, 32 have received their first dose of COVID vaccine, and 14 people have received 2 doses of COVID vaccine. In terms of areas of concern, in Greater Sydney, we're concerned about numbers of cases in Bankstown, Greenacre, Condell Park and Umina on the Central Coast. And in regional New South Wales, we're seeing cases in Cowra, Goulburn, Cessnock, Tamworth, Taree and Dareton in Western New South Wales. Most cases continue to be in western southwestern Sydney, but also we've seen case numbers quite high in the Hunter, New England area in recent days. Sadly, we're reporting the deaths of 11 people who had COVID from yesterday, 3 women and 8 men. 1 of these was in their 50s, 1 in their 60s, 4 people were aged in their 70s, 2 in their 80s and 3 in their 90s. 5 people were from southwestern Sydney, 3 from western Sydney and 3 from southeastern Sydney. 4 were not vaccinated, 3 had received 2 doses of a COVID vaccine and 4 had received 1 dose. A woman in her 80s died at the Hardy Guildford aged care facility where she acquired the infection. This is the 6th death associated with this facility outbreak. A woman in her 80s died at the Allerty Beechwood aged care facility where she acquired the infection. This is the 5th death associated with the outbreak in this facility. We'd like to extend our deepest sympathies and condolences to the loved ones and family and friends of these people who have died. In terms of sewage, our ongoing sewage surveillance system has detected fragments of the virus that causes COVID in the following communities: Dungog in the Hunter, New England area, Crescent Head on the mid-north coast, Ballina on the far north coast, West Wyalong in the Riverina, Galarganbone in western New South Wales and Merimbula in southern New South Wales. Anyone in these particular communities is urged to be really vigilant for symptoms, and if you do get any symptoms at all, please come forward for testing right away so we can help identify if you've got the infection and help protect the rest of the community. Just like to give a breakdown of cases of COVID in the regional areas of New South Wales now. In the Hunter, New England area, there have been 98 new cases reported to 8 o'clock last night, in the 24 hours to 8 o'clock last night. These include 28 cases in Lake Macquarie LGA, 24 in the Cessnock LGA, 15 in Newcastle, 13 in Maitland, 5 in Tamworth Regional LGA, 4 in the Mid-Coast LGA, 4 in Muswellbrook, and 1 each in Singleton, Port Stephens, Glen Innes, Gunnedah and Upper Hunter LGAs. In the Illawarra, we've seen 54 new cases reported. In the Far West, 6 new cases, including 3 in Dareton in the southwest of the state. In the Central Coast, 31 new cases. And in southern New South Wales, 20 new cases. Of these, 29 were in Queanbeyan Palerang region, 7 in the snowy Monaro, 3 in the Bega Valley and 1 in Goulburn. In Western New South Wales, we've seen 17 new cases reported, including 7 in Walgett, 5 in Dubbo, 2 in Burke, 2 in Cowra and 1 in Oberon. And in northern New South Wales, 7 new cases were reported to 8 o'clock last night, including 3 in the Grafton area, 2 in Kyogle, 1 in Lismore, and 1 in the Ballina LGA. So thanks very much for everyone for coming forward for testing. If you have symptoms, please continue to do so. Please be particularly vigilant as we begin to open up the state. We need to make sure we continue to suppress the transmission of COVID among people in our communities. And we can do that by getting tested early if you have any symptoms, but importantly, getting vaccinated. So key to helping open up the state by having higher vaccination rates to therefore prevent transmission within our communities. Thanks very much.